The Cannabis Conversation. A European perspective on the emerging legal cannabis industry.
Welcome to the Cannabis Conversation with Anuj Desai, where we explore the new legal cannabis industry by speaking to the professionals that are helping to shape it. Been a while since I've done a little intro, so I hope you're all very well. Next week is episode 50, which is very exciting. This week is episode 49. When I started, never thought I'd still be doing it a year later, so it's nice to get here. It's been a load of fun, and I've really enjoyed meeting so many great people, as well as continually learning huge amounts about this new, crazy, exciting industry. I hope you guys have enjoyed it too. I deliberately didn't take any sponsorship during the first year, as I wanted to just see how it develops, but I feel now is the time. So if you're a business looking to advertise to a good, strong cannabis industry following, please do get in touch. I'd love to chat to you. On to this week's show. It's one I'm really looking forward to. It's all about cannabis and anxiety. Enjoy. On today's show, I've got Dr. Rebecca Moore, who is a consultant psychiatrist. She works privately in London, but she also works at the Medical Cannabis Clinic on Harley Street. Rebecca's here today to talk to us about anxiety and how cannabis interacts with that. Welcome, Rebecca.
Thank you very much for having me here.
How are you today?
I'm very good, thank you. Good.
So this is a huge topic, and I'm really happy to have you on because anxiety seems to unfortunately feature in virtually everyone's lives nowadays. And often we talk about CBD as being kind of helpful in alleviating the symptoms of anxiety. So it'd be great to speak to you about that. But before we get on to that, maybe we hear a bit about your backstory and what were you doing before and what made you start studying cannabis.
So I've been a psychiatrist for a long time, and actually I've got sort of two very different sort of main specialities. So I'm a perinatal psychiatrist as well. So I work with women through pregnancy and postnatally, and I have an expertise around birth trauma. And I think a couple of years ago, I was lucky enough to be a Winston Churchill Fellow, where you were awarded a sum of money to go and travel and learn from cutting edge research. And I went to California, was lucky enough to go to Stanford. And whilst I was there, I suppose that's where my interest in medical cannabis and CBD began. Partly because in America, they were sort of ahead of the curve. There was a lot more conversation going on there. It was already widely used, and you could really access it much more easily. And I'm particularly interested in initially around trauma, because there's a lot of trials going on there around the PTSD population and how cannabis might have a role in treating PTSD in particular. So that really sort of sparked my interest, and it's grown from there really. I think I work in quite a holistic way, so I suppose the other big thing for me is that I just feel we should offer all the choices, and it seems to me that that is one of the choices that we should be offering. We know that medication, traditional psychiatric medication, doesn't work for everybody, that it's something that a lot of people don't want to take, that for some people it can have lots of side effects which outweigh the benefits that it might bring. So for me, it's about really truly offering people lots of different choices, and I think that for me, CBD and cannabis should be one of those choices.
Yeah. And how did you find that coming? Was it kind of an enlightenment a bit when you were in California?
Yeah.
Because obviously they're quite far ahead in terms of this. Coming back to the UK.
Yeah, so I think it's brilliant there. There's a real openness about it, and also a desire to evidence it. So, these are really high quality institutions, so they're not just prescribing, they're actually, wanting to set up big trials to look at the impact of using CBD or cannabis. So obviously as a clinician, that's really important because you want to be able to evidence what you're prescribing. And I found coming back that they're just, at that time, 3-4 years ago, as I'm sure you know, there were sort of pockets of people that were interested, but not as much as there is today. So although I've been using CBD in my practice for quite a long time, because, technically that's considered as a sort of health product, so not prescribing it per se, then obviously the change in the law in being able to prescribe as well has been really helpful for me personally, and now I'm really thrilled to be, working with a group of clinicians that, are all prescribing, and we can all learn from each other and we can share best practice, and so that feels like a really good place to be part of as well.
Yeah, amazing. Loads to talk about there, and we'll go on to talk a bit about what you're doing. Maybe it's a good idea to take a step back and just start with some sort of 101. What exactly is anxiety?
Well, that's $1 million question. I mean, I think it depends who's defining it and who's talking about it. So anxiety is a term that's used everywhere, isn't it, nowadays? But it's going to mean something different to each individual person. So, you can have a clinical anxiety where you're sitting with somebody and you're essentially screening them for a checklist of symptoms that if they have those symptoms, you could say this is clinical anxiety. But anxiety itself is an umbrella term. So somebody might have a generalized anxiety, they might have panic disorder, they might have a social anxiety. So you really need to be careful about, the exact terms you're using, because it means something very different to each person.
And are there some common threads between?
Yes, I think there's common threads, and I think it's also important to say that you don't have to have a clinical diagnosis to feel that anxiety is a huge part of your life and affects you day to day. So for me, always, I suppose it's less important to diagnose and more about actually what is this feeling like and how is this affecting your day-to-day life, because you might have 3 out of the 5 symptoms and not make a diagnosis, but actually day to day that's really tough still. So I suppose the common themes for people are what we can all recognise as when we feel a bit anxious, we feel a bit panicked, we might get that butterflies in our tummy, we might feel hot, sweaty, short of breath, a bit on edge, a bit uneasy, a bit scared. Frightened almost, and that might be tied to a certain situation. So say standing on stage and talking in front of lots of peers and professionals, or it might just be something that sits with you all the time. So it can be very variable for each person. For some people, it can have been there from very early on in childhood. Some people might have a very strong family history of anxiety, so you've been parented and brought up by a mum or a dad who is themselves very anxious, and of course that has an impact on how you see and perceive the world. So it's very, very variable, and I think what it always comes down to is listening to somebody's story and understanding what it means to them.
And what are some of the typical symptoms that people can get if they are suffering from anxiety?
I think it's that feeling of unease and feeling restless and just not able to switch off. So worrying a lot, either about something specific or everything feels worrying. And then that can mean you can't focus, you can't sleep. Sometimes people can't eat because they feel very nauseous. Or people might have full-blown panic attacks as well, where they feel really terrified and out of control and that they're going to die. And then obviously if you've got an anxiety sitting there all the time, it can affect your mood, because you can start to feel like, I can't enjoy things, I can't go out, I can't see my friends. And so it can really affect your day-to-day work, your ability to function at work, your ability to parent, your relationships with people. If you're feeling constantly tense and not able to enjoy things and not wanting to go out, then that's going to have a real impact on day-to-day life.
Sure. And I mean, I, like everyone, has had anxiety, and I sometimes feel that it manifests in sort of physical symptoms. So
a lot of people will get the classic sort of dry mouth, like you feel like you've got a lump in your throat, tummy sort of tumbling over. You can get very sweaty. You can really feel your heart pounding. But I think also you can get more subtle things, like perhaps feeling you get lots of physical symptoms full stop. So headaches, sort of tension headaches. IBS is quite linked to anxiety. Or it might just be that you have new symptoms and then get very anxious about them and sort of misinterpret what's going on in your body as well. You can feel things as much physically as you do mentally.
Yeah. And how's anxiety been treated sort of historically and now? Has there been a shift in the way that it's been treated?
So So I think for most people, it would probably be a case of, you feel like this, you pluck up the courage to tell somebody, which is usually a GP. Sometimes the response you get is absolutely brilliant. Sometimes it's not. We know that it's very variable for people. And in the UK, for most people, it would be offering therapy and or medication. Often therapy is the right place to start because it's at a degree or a level where therapy is great and it can work. Huge evidence base for therapy working really, really well with anxiety. So usually CBT, cognitive behavioural type work, is what's offered most often in the UK, I would say. And then for some people that doesn't feel enough, or they don't want therapy, they don't like the idea of talking to somebody, so they might choose to take medication. And that would typically be with an antidepressant type medication, so one of the SSRIs, such as Prozac is the one that, most people will have heard of. Or there are some sort of shorter term medications you can take if you're very profoundly anxious. But that would be the sort of typical route for most people. And a lot of that would be managed within primary care by the GP.
Yeah. And I guess with therapy, is that effectively sort of re-evaluating your relationship with the situations that make you anxious?
Yeah, so it's thinking about so first of all, recognising your thought pattern, how you respond to things, what the judgments you're making about risks and threats and what might happen, and then perhaps beginning to reframe those thoughts and challenge those thoughts. So how likely is that actually to happen? What would happen if that happened? What's the worst case scenario? And it's really effective. And the great thing about therapy is that sometimes people can feel better within a relatively short space of time. But I think if people have had lifelong anxiety, say, that sometimes that can help at the time, but then often people feel a creep back of those symptoms. And so for me, that's where something like CBD comes in, is it's just another thing to have as part of your toolbox. Yeah. And that might include exercise as well, or supplements, or managing your sleep. But, for me, we need to think about all of those bits.
Yeah.
To really, truly give somebody the tools to look at every single part of their life and think, I can do this bit and this bit and this bit. And that's really helpful for people going forward, because it's things that they can do themselves and take ownership of.
Yeah. I've always found exercise very
Exercise is amazing. So there's lots and lots of literature about exercise being really effective for anxiety and depression, and as good as antidepressants in some big trials. So I always encourage people to see exercise as part of my prescription, and it doesn't have to be anything fancy. It doesn't have to be anything that costs money or takes a long time. So starting small, just a 10-minute walk around the block, or doing something online that's free that you can do at home. You don't have to go to the gym. Yeah. You don't need to put any special clothes on. So just really small chunks that you can build in, and things that you really like. You know, don't go running if you hate running. There's no point.
I forced myself before.
Pressure to yourself. But, think about what you really, really love and do 5, 10, 15 minutes of that, and then just build that into your routine. I think the other thing about exercise is particularly breath-based exercise. So things like yoga, Pilates, breath work is phenomenally good for anxiety, because we're tapping into the parasympathetic vagal nerve, and it's going to calm down our nervous system.
And that's something as simple as deep breathing.
Yeah, so you can do things like breathe in for 4, hold for 4, breathe out for 4, hold for 4, a sort of square box breathing. And even doing that, learning to do that within 2 or 3 minutes will just be dampening down your nervous system. I use that all the time. It's really, really good. If I'm feeling stressed out and I'm late and I'm on the tube, I can just close my eyes and breathe like that. No one knows you're doing it.
I've just recently learned about square breathing.
It's just amazing. It works really, really well.
Definitely. I'm going to come back to stress actually just quickly, but I'm going to wing it here with my Google medical degree. But is exercise a way of kind of burning up adrenaline or using the adrenaline in your stomach? Because often people, as you said, people feel it in their stomach. Is that something?
Yeah, so I think lots of people feel that it helps them burn off that adrenalized feeling, and they feel more fatigued afterwards, and you've got a nice boot of endorphins, which, again, make you feel relaxed and calm. So there's no doubt that, neurochemically it is helpful as well. And I think also it distracts if you're constantly worrying. If you're doing something like a yoga sequence or a run and you can put music on, it's a good way to distract yourself from those thoughts as well. Yeah. So it's really a win-win all round.
And before we get on to cannabis specifically, you mentioned the word stress, and I think that is also extremely prevalent. Mm-hmm. Are the terms kind of interchangeable, or is stress a type of anxiety? Is anxiety a type of stress?
Yeah. I think stress is probably something that we'd more commonly feel was sort of less clinical per se. It's not a diagnosis as such. Okay. Although obviously if you're under high amounts of stress, you can become anxious or depressed. So I suppose stress is just part of life, isn't it, for most of us? It's a common thing that we all feel at points through the day. And it can cause many of the symptoms of anxiety, when we feel stressed. Whereas anxiety, I think, is something that is more intense, usually more severe, sits with us for a longer period of time than stress per se.
Right. Okay, good. Thank you. Cool. So cannabis, how does that fit into this? And it's probably useful to maybe break it down into medical cannabis, i.e. full spectrum, and then CBD.
Yeah. So I think to begin with, often when people come and want to seek advice about that, I think that is probably one of the misconceptions, is that, people don't recognise the difference between CBD and medical cannabis, perhaps. And I think perhaps in the last year we've sort of been bombarded a lot in the media about CBD in particular. And I suppose, there's the view from some people that, well, I can buy this in Holland and Barrett or Boots, so, it can't really be that effective. So, all CBD is not equal, essentially. And if you're coming for a consultation and you're thinking about taking medical grade CBD, it's very different often to what you might be buying off the street.
And how exactly is that?
It might be the quality of it, knowing exactly what's in that bottle, knowing the precise dosage. So it's just a cleaner, more medical product. So I know for sure what exactly is in that bottle and what the dose is and how to use it and what dosage that person might need. Whereas I think, if you're buying, even my newsagents, I noticed the other day, has some CBD on the shelf. And I think that's probably not going to be the same quality as something that you would buy medically. So it's about a greater assurance that, you know exactly what you're prescribing and that it is very well grown and manufactured and clean. So it's more of a sort of medical, you know exactly what's in it, essentially. Yeah. And I think CBD is something that works beautifully with anxiety for a lot of people. I've used it with people who've had both lifelong and short-term anxiety, and for some of them it's been utterly life-changing, in a way that was just quite wonderful to see. I think often people don't need to take very high doses also, and the change can happen quite quickly. And the other thing that's very good from the person's taking it perspective is that, in my experience, the side effects are very, very minimal as well. So there's been some absolutely wonderful, things to watch for me as a clinician, where people have been trialled on numerous different antidepressants, have felt that their anxiety has just really been in control of them rather than the other way around. And taking a relatively small dose of CBD have just felt their anxiety melt away. So that, that I think that is just fantastic to be able to offer to people as a choice. I think it's also interesting for me working with women as well, where you get a lot of women with PMS and cyclical change, where the research is not brilliant. There's nothing particularly, new treatment-wise. Often women are offered the pill, or they might be offered the antidepressant to take all the time or for 1 to 2 weeks of the month. And the evidence for it is not great. So again, I think for them, CBD can often be really helpful in that it's something that is has far less side effects, but can really help them manage that premenstrual change in their mood and anxiety. So it has so many different sort of uses that I think it's absolutely brilliant for. Medical cannabis, I suppose, I would use less for anxiety. I think that actually CBD for most people works really, really well. Where the medical cannabis can be really helpful is if there's big issues with sleep. And often people have got into real difficulties with sleep when they've had long-term anxiety. They can't fall to sleep because they're just lying there worrying, or they wake in the night and then they're just getting progressively more and more exhausted. And then that tends to have a knock-on effect on their mood, of course, because they're just tired all the time. So I think in that situation, medical cannabis can be really helpful in terms of taking something at night to help sleep, and that mixture can work really well. But it's always sort of a very bespoke prescription to each person, really.
Yeah. I mean, that's kind of what makes the plant so fascinating, is that the amount of active constituent compounds is so vast that there's a virtually infinite sort of number of combinations and ratios, etc. If we're talking about CBD, do you typically recommend a broad spectrum CBD or an isolate, or?
So typically a broad spectrum for most people. I mean, I have to say here as well is that, I feel like there's so much I don't know yet. So, I am a relatively new prescriber.
There isn't a body of research.
And there isn't a huge body of research, and I'm learning as well. And I think there are going to be so many things that we learn in the next 5 to 10 years anyway. So that feels really hugely exciting. So I think on the whole, at the moment, I tend to use more of a sort of broad spectrum. Sometimes there have been particular cases where, the CBD hasn't been, had that effect that you want, and has actually made people feel too alert.
Oh, really?
And sometimes that's about when you take it or the dosage. So I have found with some people you need to shift it to earlier in the day, because there does tend to be a group of people where if they take it too late at night they can't sleep, but it still works brilliantly for their anxiety in the day.
Brilliant.
So I think it's it's just about, I'm very open with people about the fact that I have an experience, but to a certain degree all of us are on this journey of learning. But that I believe in this wholeheartedly. I believe that it's very safe, and I believe that it is a really good option. So we tend to just be very careful and slow and cautious in how we work to taking it. And I think that's really good for people psychologically, because they don't have any concerns about side effects then, and it's a constant dialogue and communication and tweaking doses and times. But on the whole, my experience has been that most people take CBD with very few side effects.
Well, I mean, this is it. So we frequently talk about this in various different guises, but if you talk to someone who's sort of more traditionalist or establishment, if you like, who often say, where's the body of evidence or where's the research? It's difficult to point to sort of robust stuff, which I assume is going on at the moment, but hasn't yet been published. However, I see so much anecdotal evidence of people who are taking high street stuff, so hopefully better than stuff in the newsagent, but possibly not medical grade, who've genuinely said it's sort of transformed their relationship with anxiety. And so there's a gap of knowledge, isn't there, where something's happening here in the middle, it hasn't been sort of written down yet, if you like.
I think there's a gap of evidence, sort of RCT controlled trials type evidence. But I also think we do a real disservice to the people we're working with if we don't place their evidence as being on par with that, because they are living with these chronic illnesses. So who better to know how that feels than them? So to me, if I've got, can read stories of thousands of people who've had chronic illnesses of all different kinds saying, oh my goodness, this was amazing, then we have to take notice of that, right? Because they are living with this. They know better than I what it feels like to live with chronic anxiety. So if they're telling me, and which they are, this is amazing, then I'm going to take notice of that.
Yeah. And do you think this, I mean, the obsession with RCTs and this form of evaluation in medicine it's not necessarily the definitive way that we should be looking at medicines? It's...
Of course you want to have ideally you have a mixture of both. So of course it's lovely to have that beautifully trialled with all the confounding factors taken out so that you can clearly say, wow, look, this dose of CBD reduced all these scores by 60-70% in thousands of people. That's really reassuring as a clinician, as a prescriber, and for the person taking it. So you want a mixture of both. But I think personally that hearing from somebody with lived experience, when you hear somebody's story in this field, whether it be pain or epilepsy or, gosh, you can't forget that. And it's so powerful. And, it makes me feel really excited to be in this field because I think that is really important to me. That is as important to me. I want to hear both sides of the story.
Yeah, it's frequent topic about patient data, I think. So there's lots of projects that are sort of looking at these things.
So I mean, as a psychiatrist, there's the Royal College of Psychiatry have got a great project, and they're looking to be able to make medical cannabis more accessible and beginning to collect large scale data, and so it's brilliant that we are collecting that as well. But I suppose as a perinatal psychiatrist, where all my prescribing is essentially off license because women are pregnant and nothing's specifically recommended in pregnancy per se, then I'm more versed in having to think about risks and benefits and talk about that, so it perhaps doesn't feel as terrifying to be prescribing as it might be for some colleagues, which I completely understand, because if none of your peers are prescribing or your college is saying we're not sure that you should be prescribing, I can understand how that might feel more difficult to do.
Yeah, it's not as simple as why aren't doctors prescribing it. There's quite a significant, if it's not been taught previously and the general understanding isn't there, it's quite sort of naive, I suppose, to expect people to suddenly just turn and change. It's a journey, isn't it? Yeah,
I think it will take time, but I think as more of us are prescribing in, specialist clinics, and then we have more data coming through and we have our own data and outcomes from patients, then hopefully that will enable other people to feel confident to prescribe as well.
Yeah. And the patients that you see, are they on the more chronic side of the spectrum than sort of generalised anxiety?
So at the moment, usually we'd be prescribing where there's a sort of case to be made for it as a last resort. So often people will have trialled numerous different things, therapy-wise, medication-wise. So they tend to be people with more chronic illnesses, and also a huge group with trauma, with PTSD. So that might be military veterans in particular. And, a lot of these people are using cannabis already, but they're buying it, and they don't want to be. They want it to be properly prescribed and to have somebody that they can be continually touching base with. So it's a very varied mix of diagnoses and presentations, I suppose, but they tend to be people that have been struggling for a very long time.
Yeah, I'm sure. And what's the sort of typical dose that you would be giving in this, like a range of?
In terms of CBD, it's very variable. I've found that for anxiety, somewhere around the 100 milligrams mark tends to...
Per day?
Per day.
Wow, okay.
Tends to work. Sometimes it's less. It just depends on the person.
Yeah.
Often they'll take it in divided doses, so it sort of holds their anxiety through the day. And then with the medical cannabis at night, then it's just a case of starting really low and titrating up to see how much they need to sleep, really. But for anxiety specifically, around 60 to 100 would be, I think most people would be starting to feel some benefit.
Isn't it typically in a tincture?
Yeah, so my experience has been that most people prefer to take it that way for anxiety, particularly. Some people vape, but most would take it as a tincture.
Yeah, because I was just going to say about vaping, I guess it's more instantly absorbed into the body.
Yes.
Is it more bioavailable as well?
You just get a quicker
It gets into the system
from
quickly,
it if you're vaping. So that's why it's so great for pain, because
Yeah.
you're getting that instant relief. I think for anxiety, because you want it to be sustained throughout the day, I find that people are more likely to find a benefit from taking a tincture.
Yeah.
Occasionally people will vape at night, but rarely actually. Tends to be mainly tincture.
Yeah.
Yeah.
And that's just funny what you were saying previously about some people being more awake off it, because one of the areas that people take CBD for is to help with sleep.
Yeah, no, I know.
So it's,
But I guess
that just shows how complex it all is.
it shows how complex it is. It shows that, you know, there is always going to be a range of response, and there's always going to be people that are very sensitive to medication and have that kind of paradoxical response. It's something I've seen with a couple of people, so it's definitely not common, but it definitely happens. And as soon as we shifted the CBD backwards in the day, the sleep was better again.
Yeah. So it's,
Yeah, so it's just a case of sort of tweaking it.
Yeah. What I find fascinating about this evolution of cannabis is where it meets the evolution of sort of personalised medicine as
Yes,
well.
exactly.
You know, very much looking at you and you as an individual rather than just...
I think that's why I'm sort of drawn to it, because I suppose that's kind of how I like to practice anyway. And I've always been the person that sort of for years has given people advice on supplements, blood testing, you know, a much more sort of functional, integrative way of working, I suppose. So for me, it just fits really beautifully with that.
Yeah.
And, you know, I don't want to sit in a room and tell people what to do. I want us to think together about what they feel would really work for them. Because otherwise it's no point. You know, I can tell people to go and have therapy, but if they don't really want to do it and aren't really committed to it, it's not going to work for them.
Yeah.
So I want to offer as many choices as possible and then cherry pick. You know what, I really like yoga. I like the idea of CBD. I want to start with that. Perfect, fine, let's do that.
Yeah.
And then it's just more of a collaboration.
Yeah. So, on the flip side, how can cannabis be bad for anxiety? I mean, I know some people, not very well, if mum and dad are listening, who feel, you know, more anxious after consuming cannabis.
Yeah, so I think it's, again, like we're talking about that spectrum. So it depends what people are using. So obviously if people are buying off the street, we know that probably the concentrations of the THC are going to be significantly higher. And there is no doubt, you know, as a psychiatrist, I have seen for many years the effect of smoking cannabis, particularly on,
Very high THC stuff.
yes, particularly on young men. So lots of psychosis. So that's why, you know, I want people to come and see a specialist and have a very thorough history, because we want to know about any prior history of psychosis, family history of psychosis, because there's clearly a link there. And we want to be very careful and cautious about that before we prescribe. And yeah, there's no doubt that for some people it definitely heightens their anxiety, can make people feel quite paranoid and really low and just much, much worse.
Yeah.
I think, again, that's about possibly what people are smoking, using, that probably it's very high in THC. So when you swap people to CBD, often you find that it works really well.
Right.
And that people are surprised because, you know, understandably, you can offer it to people and they can think, well, my other experiences have been not that great, so I'm not sure. And I think that's important to say as well, is that, you know, by no means are we prescribing to everybody that we assess, because sometimes it's not the right thing.
Not appropriate, yeah.
So people might come and ask, and we might be saying no because of this family history, or because actually I don't think you've tried enough on the normal NICE guidelines pathway yet. So it's not at all the case that everyone we see would be prescribed anyway. But I do find that for most people, if you start with CBD, that actually that is really effective for people, even if they've had a bad response in the past, because it's the difference between the CBD and THC is huge.
Yeah. And I suppose if people are smoking, there's tobacco in there as well.
Exactly, there's so many other things in there.
So it's a lot of different factors.
People don't know exactly what they've bought. They don't know the strength of it. They're often, I think also, when you're smoking, it's at a much higher temperature, so it actually affects the quality of the THC that's in there, rather than vaping it, say, would be burning it at a lower temperature. So you're getting lots of sort of bitterness and different taste, and there are so many variables that actually people are usually very surprised when they try something like a pure CBD.
Yeah,
the experience is completely different.
And again, I'm going to wing it here, but I did read something about that actually a significant part of the negative effects of cannabis smoking, of street skunk, let's call it, is not so much the very high THC content, but the lack of CBD in it to sort of counteract.
Yeah, I mean, I don't know the precise amounts, but I think that is probably undoubtedly the case. Plus you've got the nicotine, plus you've got goodness knows what else in there, in the mix. So
yeah, cool. And so I think we've kind of talked about, is there a new paradigm needed to evaluate this sort of stuff? And 2021, the drug science guys are doing some great stuff there. There's a program in Denmark, which is great, doing some great stuff. France, I think, have just sort of okayed one. Israel have been doing it for years. Yeah. So hopefully we're building a good body of evidence. Where do you see this research sort of heading, or is there anything you're excited about waiting to hear the results of in this area?
There are lots of trials in progress, particularly in America, that I'm aware of, that are coming from big bodies of, like Stanford, for example. So I'm really excited to see the results of those, because I know that the quality of the trials will be really, really good. And again, for me, I'm really interested to see how they relate to PTSD and trauma in particular, because I think that is, aside from anxiety, probably the second biggest reason for people coming to have a consultation. So I'm really interested to see what it shows, because there's been some preliminary data suggesting it might be able to even affect the way we consolidate memories after trauma and affect nightmares and other symptoms of PTSD. So I'm really interested to see, actually what it shows in big quality trials. And I think just being able to have a bigger pool of data from all across the world will be so helpful. Because I want to be able to talk through trials with people when they, I do in terms of perinatal psychiatry all the time. So we'd pull up whatever drug they're on, talk about the trials that exist. And I want to be able to do that, in this field as well. So just really excited about, because I think there will be a lot coming out in the next 5 to 10 years that will change the way that this is perceived as a choice and as a potential thing to prescribe. I really hope that people will, feel confident then to be able to change their practice and prescribe.
Yeah, and it's one of the issues that NICE highlighted, didn't it? Just basically need more research. Was disappointing because there's many people in need. So hopefully that research comes, as soon as it can. And inevitably this sort of, leads into the topic of psychedelics, I think, and particularly around trauma and PTSD. What are you seeing in that area as well?
So lots of chatter about it. I think it's really fascinating. I think at the moment, again, I would say it's too soon for us to be making definitive, sweeping conclusions about these substances. But again, particularly in America, they already use ketamine as a treatment for depression, as a nasal spray. And there's definitely some evidence there around that. I think the use of mushrooms, there's lots of studies going into that as well, at sort of microdosing of MDMA as well. And I know,
which I've heard has been very effective in relation to PTSD.
Really effective. So there's been a really good big study where they gave people microdosing of MDMA, and the symptoms dramatically reduced to the point where I think it was over half, but don't quote me, I need to check that, no longer fulfilled the criteria for PTSD.
Wow.
I think as yet we don't know whether that holds over time, and I think that's what people are concerned about. Is this a sort of immediate change, but then symptoms return. So clearly there needs to be longer term follow-up studies. But I think the whole area is really fascinating and really interesting. There's a psychiatrist in the UK, Ben Sessa, who's a real leader in this area, and his work is fascinating. So I always look forward to reading what he has to say about it. And I just think it's the same thing. It's another area where potentially there will be more choices for people.
Yeah. As a clinician, if you can look at your career, do you think it's has this sort of caught you by surprise? Is this something that you never expected to see? The fact that we're talking about what had, been viewed as recreational, illegal drugs now being used as therapy and...
No, I just think it's really interesting. I suppose as a person, as a psychiatrist, as a doctor, I'm quite open to thinking about and considering everything. I think that's perhaps the nature of being a psychiatrist to a certain degree, is that I have heard lots of different stories and tales and things, and I suppose I'm quite open to hearing anything in the space. That's part of what I do. I'm not here to judge, or I'm just here to be curious and to learn from things. And so for me, I just think it's really exciting, because it's fascinating, and the early studies seem quite hopeful. I think there's lots more work that needs to be done to clarify how these might be integrated. But again, if it's another potential choice for people, then great.
Yeah. And do you think as your experience as a psychiatrist, have you seen other people in your field be similarly open? And do you think psychiatry sits slightly outside sort of medical doctors and their approach to it? Because I obviously speak to a lot of doctors who are in this area and they've faced significant criticism or barriers. Have you found that slightly less in the field of psychiatry, or?
I think probably mixed would be the truth. I think, there are a lot of amazingly free-thinking, perhaps shall we say, go so far as to say anarchic people within psychiatry, and maybe that's why I love it so much. I would not want us to be seen as separate to medicine. I think that's a battle that I've faced my entire career, that you're not a proper doctor if you're a psychiatrist, right? Which I would refute strongly.
But I guess it was a way of complimenting you. You're more open-minded in your field.
No offence taken at all. But I think it's mixed. I think you get a group of people who are by nature very curious, and they're completely open to learning more and thinking about it, and are looking forward to what the next few years bring. But also, as with other specialities, I think there are a lot of people that are very fearful to prescribe for, like we said, lots of different reasons, feel that there isn't an evidence base there yet. And I think particularly within psychiatry, like I said, when so many of us have seen the effects of using skunk and other drugs on mental illness, then there is a criticism of how can you possibly be prescribing something that we know for so many people can be so detrimental. And I think often that comes from a lack of understanding of what you're actually prescribing. And sometimes when you're able to have that discussion of, look, actually I'm mainly using CBD, and this is, then people are more open to that. Yeah. But there's no doubt that a lot of people are reluctant to prescribe and very cynical about the effects.
And that's understandable, as you say, if you're seeing, a regular flow of patients suffering from psychosis due to street skunk, or as a contributing factor, then it's quite. You almost need to unlearn a bit before you approach it differently. And
I think we have to be clear about, there are certain presentations where, if you were coming with a history of schizophrenia and a very strong family history of schizophrenia, as yet I would not be prescribing, because I just feel that we don't have the evidence there to support that person at this time. That may change. So, it's definitely going to be focused at the moment more to people with depression, anxiety, sleep issues and PTSD, because that's the right thing to do. And as we know more, it may be that there is more of a role in psychosis, but I think as yet we can't definitively claim that.
Yeah, we're still early in the journey, aren't we? I think a lot of it is as you say, it's a lack of understanding. The stigma comes from almost viewing cannabis as a sort of homogenous product rather than a basket of many compounds that can be arranged in a different way, different strains and different ways, etc. But also, quite significantly, it's not just about smoking it. It's tinctures and oils and vaping and eating and all these sorts of things, which are delivery methods that kind of would make more sense to people than, because smoking inherently doesn't feel like a thing that you should be prescribing.
No, of course.
Although on some people it can be extremely effective.
Yeah.
But that's a sort of different topic. I think the idea that it's much more complex than a very kind of binary, skunk is bad and write the whole thing off.
Yeah, exactly. And I think once people understand that, it's much more bespoke, prescribing and learn more about it, then, people do become more open to it.
Yeah. Cool. So this leads me into my final question. What did your family say when you told them you're going to be working in a cannabis clinic?
Oh my gosh. So I think my husband thinks it's brilliant. My dad thinks it's brilliant. My friends think it's hilarious and brilliant at the same time. So yeah, they've all been really, I suppose my mum was perhaps a little bit more Daily Mail-ish about it, shall we say? Does that say it all? People know what I mean.
Yes, I think they do.
She was perhaps a little bit more sort of, oh, wow, I wasn't quite expecting that. But then I think she got so excited by the fact that I was going to be on Harley Street that she kind of forgave me. So I suppose, they've been really, I think perhaps, they know what I'm like, and, it's not unexpected for me to do something a bit different.
Yeah.
They've all been hugely supportive.
Oh, fantastic.
And the more I've spoken to them about it, the more they've, also learned and seen. Obviously I'm not talking to them about clinical cases, but, when there's been stories in the press when you read those stories of how impactful it's been for people, they can see why I want to do it.
Yeah.
Yeah.
And I suppose, if you're going over to work at Stanford, then that's pretty prestigious and serious.
Yeah, I mean, I'm not, that was a sort of one-off part of the Winston Churchill, but, I'm following all the work that they're doing really closely.
Yeah.
And I think, when you can say that institutions like that are trialling this, then it gives it some gravitas.
Yes, absolutely. Yeah. Cool. Well, thank you, Rebecca. That's been really brilliant. I've been really wanting to do this show for ages. I'm really glad that you've filled us in on loads of stuff here. Lots more to come as well. Yes. Well, I'm sure hopefully there'll be a part 2, 3, 4 as we get more and more, data and research. That'd be brilliant. Absolutely. Thank you. Thank you.